Yeah, yeah, I'm going as fast as I can. I'll start
Yeah.
recording and we can get started whenever.
Okay, I'm just going to let a few people in here. I know I'm messing up your system, but
That's okay. I can
phone
cross
rang.
reference afterwards.
Hello there, Jim VanDusen.
Hello, Mr. Taylor. How are you, buddy?
I'm good. How are you doing?
Very good, thank you.
Good, good.
Been a pretty fun, interesting, crazy time.
Yeah, all of those and more. Yeah, that's for sure. Yeah,
It's good to see you.
yeah, you too.
And Jim, now that I know you're here, I'd like to just welcome everyone. I think we'll get started in the spirit of time because I know there's going to be a lot of questions today, and we have 3 speakers with us. So Jim, I would first like to ask you, Jim VanDusen from New Roads Automotive is our board chair, and I'd just like him to say a few words.
Thank you, Tracy. Good afternoon, everybody, and thanks for joining us. I can say that this has been a rather strange year, as we all know, but particularly when I look at my position as chair on the board, without being able to go out to events and different things, it's been very bizarre. But I welcome everybody, and thanks for coming. I look forward to finding out some information like the rest of you on what reopening all means. For us in the auto business, we've been open for a while as an emergency service and working through different iterations of it. But I definitely want to thank our speakers as well, guys, for coming out and helping out. And I think information is key, and that's what we're all looking for all the time, to be able to be as effective as we can. So we're trying to share as much information as we can with you through the chamber. And I think Tracy and your team have been doing a great job. So kudos to Tracy, and thanks everybody for coming.
Perfect. Thanks, Jim. And I'd also like to recognize James Daigle from Tree Frog, Kyle Burgis from Minkin Employment Lawyers, and Carol Shirtliff-Hines from Shirtliff-Hines Law, also from our board. I don't think back in November when they signed on, they quite knew they were signing on for this. So thanks for your support along the way. With the announcements recently around phase 1 of the reopening, we thought that this conversation, and probably a number of them in the weeks ahead, was extremely important, not only from the perspective of getting businesses ready to reopen and all of the questions around that, but also from a health perspective. Diligence and caution is still very much the focus, and we need to remain vigilant if we want to continue to build on the progress we've made and reducing the number of new cases that continue as we move forward. So with that in mind, we have 3 guests today. I'd like to welcome Newmarket Mayor John Taylor, Dr. Leon Genesove, public health physician with York Region Public Health, and Kyle Burgis, a lawyer with Minkin Employment Lawyers and our vice chair on our board. I'd like to call on each of them to give us just a brief overview, and then we will open it up. We'll open up the chat to questions. So I just ask everyone to please mute your microphones if you haven't, other than our speakers, of course, and use the chat function for your questions. So I'll have Abbas Samad, our Director of Government Relations and Policy. He'll be helping me bring forward questions today, and Jennifer and Tyler from our team will also be helping me to manage. There are over 100 people on this call, so we may not get to everyone's questions today, but by putting them in the chat, we'll be able to respond to you even if it's as a follow-up afterwards. We're recording the call today as well, and we'll make that available to you. And I believe we have Sarah Campbell from MP Van Bynen's office and Don Gallagher Murphy from MPP Christine Elliott's office on the line today as well. So we can follow up with them on any of the questions that have federal or provincial jurisdiction if we're not able to answer them today. And with that, I'll turn it over to you, Mayor Taylor.
Thanks very much. I'll try to stay fairly high level in my comments about reopening, just because I think probably people want to ask questions, and I could talk about a lot of this stuff for a very long time. But look, it was early March when we discovered that we had a COVID-19 case in Newmarket related to, as some of you may recall, related to a person who was an attendee at our senior center, and that was very concerning. And we took steps at that time to close the senior center down. And at that time, also, I became ill and I was tested, and thankfully tested negative. Shortly, and a little while later, we were one of the first communities to declare a state of emergency. close down our playground equipment prior to the provincial requirement to do so, and took many other I believe, very quick steps to try to take the safest approach possible. And I think the reason I mention that is because I think as we reopen, I want people to know that we'll be guided by the same principles in Newmarket, that we're going to be putting our role and responsibility for safe and health and safety first, and containing COVID-19 first. Obviously, we weigh that against the economic impact it's having and the need to reopen the economy. But we still have to go with those first principles. And so I say that because I think it's going to be incredibly important that the reopening, we're going to take our guidance from the province. We've received some of it yesterday. But when we get that guidance, we then have to contextualize it within the GTA and within Newmarket. And I think you're going to see a lot of discussion about how the GTA numbers related to COVID-19 are a little more challenging than the rest of the province. And you'll see some of the mayors have already spoken out, John Tory and Mayor Scarpitti, about the need to make sure that we're reflecting that in how we take our steps forward. And so we're going to take, as the province is, in the guidance it's providing, but this reopening is going to be a very gradual reopening. It's going to be a very phased reopening. As I'm sure many of you can guess, we probably won't see gatherings or crowds of any size in this calendar year, is my guess. We'll see. Of course, the other thing we'll do is adjust as we go. If the numbers and the COVID numbers and the guidance of the health professionals allow us to do more, we will certainly do that. We want to, within the realm of safety and health, we want to enable a reopening in a successful business community as much as we possibly can. But I would like to, for Newmarket, while we led on the closing down in many ways, I would like to maybe lag by a week or so on the reopening and see how some of other jurisdictions do with trying to figure out some of the challenges that might come out of that. But not by much, but I'm just being very frank. I'm not going to be looking to be the first out of the gate on anything necessarily, but we want to facilitate and move forward. And so coming to today, again, we're starting to react to what the province gave us yesterday. We've been in meetings all day. And I know a lot of the questions will be about that. I'll just preempt things by a little bit by saying it, not to want to welcome all questions, but we're going to need people's patience as we understand, even from a municipal perspective, what does the reopening mean of, for example, tennis courts and some sort of single player sports and perhaps fields soon or now. We're going to need to look at that in light of how we can't just say they're all open on Tuesday. We have to figure out a realistic and safe plan on how to reopen these things, which might take 3 or 4 or 5 days to do so, and to make sure that we have the staff there to support it. And we have to also make sure that when we're opening something, that there's also a business case for it. So I'll just throw out an example. It might frustrate somebody if you remember, but we have a gym in our a personal fitness gym in our Magna Center. Do we open an entire facility of that magnitude and the costs associated with it when that's the one potential opening that's allowed at this point? That'll have to be thought about. So like yourselves making business decisions about what makes sense to open, how to do it safely for your employees, how to serve your customers the best you can, but also protect them in the process. That's the process the town is going through too. We'll be looking to, we'll continue to partner with the chamber throughout this. So part of reopening, I believe, is trying to create the best possible business environment we can in Newmarket to support those businesses. So being innovative, like our Shop Local program, like the Business Concierge Assistance Program, and partnering with the chamber to do those things. We'll be announcing another program next week that I'm excited about. I've hinted before about it, but it's related to mentoring and getting business mentoring and advice from people and how that can be structured. So we'll be looking to do that as well. But we need to also create those partnerships and that environment for success. We recently instituted curbside parking only on Main Street to make sure that all of those restaurants that are doing curbside pickup, and there's at least 10 of them, that they have easy access, cars in, cars out, not people parking there for 3 hours while they go for a walk. So any little things we can do like that, we're open to suggestions, and we want to move forward as many ways as we can, partnering with the chamber, of course. The message I'll leave everybody with is this, and it's probably the one that's most important to me, is that there's been a lot of, this has been difficult, and there's been a lot of, frankly, a lot of suffering. financial suffering, health suffering. I know people who have passed away from COVID. I know people whose families are in isolation. There's mental health impacts, isolation, financial, business hardships. We've endured those to contain COVID-19. And if you think about this, and this is a message I want to share over and over, as things start to reopen, people tend to think, oh, things are relaxing. We can relax a little. If you actually logically think it through, as things reopen a little, as you're able to maybe have a couple of customers in a store, or I'm able to go to a garden center, or you can go play tennis, that means more people coming into circulation and more potential for contact. So the need to be vigilant and committed to social distancing and hand hygiene and isolation if necessary is actually increasing right now. The need to focus on that becomes greater as we open. It doesn't tail off as we open. So, and I'll tie that back to what I just said about the suffering and the business hardship and the economic hardship. We don't want to go through this again, right? So all of us making sure that we're opening our businesses in the way that's allowable, but also taking extra precautions in ways that are safe and responsible, but while trying to get back to business and get revenue flowing, but that we all do our part in making sure we keep that golden rule. I say it over at 6 feet, 6 feet, 6 feet. That's the way the trend line, the numbers on COVID will continue to plateau or decrease, and means we can do more opening, and means we don't have to backtrack and close, right? So I think if you're thinking from a business perspective, what's the biggest thing the town, the chamber, any business person, any individual in this community can do to ensure that businesses can start to reopen and can start to get some revenue going and can succeed over the next 2, 3, 6, 8 months? The number one thing we can all do is stay 6 feet apart, keep up strong hand hygiene, and keep those COVID numbers down. So happy to answer any questions. Last thing I'll just say is, it might not be an area of interest, but I can assure you that our town staff are going through incredibly detailed plans, like many businesses are, about exactly how reopening will happen in our organization, our facilities, how to do it safely, how to stage it. And there's a lot of work being done in that area as well. And I'm just glad it's getting done. So there's a clear blueprint forward, and we're developing our blueprint as well. So a lot of topics I touched on there, but I think I'll stop there because I know there's other speakers and I know there's questions.
Yeah, and John, I think Mayor Taylor, we'll open it up to questions, I think, after we've had the speakers. And I think you've touched on a lot of subjects that lead nicely into Dr. Genesove's conversation for us.
Thank you. That was an excellent lead in, covered a lot of the issues in summary that I'm going to cover. Thank you very much. So I'm Dr. Leon Genesove. I'm a public health physician with the York Region Public Health, and it's a pleasure to be here. I think our goal is, as Mayor Taylor said, is we want businesses to open, we want them to open safely, and we want your workers to be safe, and we want your consumers to be safe. So I just want to start with, this is a bit of a review because Mayor Taylor's mentioned it. You've seen the, backwards, but you've seen the print media in the newspapers with some of the major points that the mayor's mentioned. So practicing the physical distancing, washing hands, and what's come up in the print media messaging from the province is wearing a face covering when physical distancing is a challenge. And I think these are all important messages that I want to emphasize at the beginning, and I'm going to take a few minutes to go on and expand in a little bit of detail. So we've looked at this provincial messaging, and certainly here in York Region Public Health, we're aligning with the provincial messaging and the provincial plan. And as Mayor Taylor said, probably going to require some local tweaking as things move along. I want to mention to people now that for York Region, you'll see on our York Region website, york.ca/COVID-19, there's a whole range of data information for you, a whole range of resources that support the provincial plan and explain the provincial plan and provide some context specifically in York Region. I'd also encourage everybody to have a look at the weekly video update that our Medical Officer of Health, Dr. Kareem Kurji, posts every week on Mondays. It has important information and important updates. And so you should all have a look at that site, Dr. Kurji's video, and the information posted on the website. In addition to the resources and helpful information and data on the website. The province has provided some other information specifically for businesses that's useful for you. So on the ontario.ca site, you'll find, as mentioned in some of the news releases from the province, there's about 90 different workplace specific resource sheets to help you with some specific guidance for your particular sector. And also the Ontario government is funding several health and safety associations to provide you with specific advice on health and safety related to COVID-19, among other, all the other topics. And I'll specifically mention those. For example, workplace safety and prevention services in the retail and service and manufacturing sector, and the Infrastructure Health and Safety Association for the construction and renovation sector. So those are important resources also provided by the province. Let's talk a little bit about the basics of health and safety for business continuity. So right now, one of the challenges we face, of course, there is no specific medical intervention related to COVID-19. There's no vaccine. There isn't a specific medical treatment. So we have to look at appropriate public health interventions or non-pharmacologic interventions related to that based on public health principles. And I'll just go over those in general right now. So there's 4 main public health principles that we have to look at as we safely open up businesses in York Region. So these are health protection practices, doing a risk assessment of your particular business and sector and seeing where the health and safety issues may arise in those particular areas. Let me just mention one, for example, as an example. Say the restaurant sector, if we open up completely, so we have a situation where between workers and the consumers or the clients, you could have medium contact intensity, you could have a range of intensity of contacts. There could be a small to a large number of contacts. We have to adjust for that. And but there is potential for modification to reduce that risk. Some of the other measures you may want to look at, and depends on the type of business you have and what's going on with the particular business and whether you're dealing directly with consumers or not. Screening in the workplace, or when people come into the workplace, if people actually physically come into the workplace, and that could be passive or active screening, which has a whole lot of questions around it also. And certainly record keeping, especially among the workers, your employees when they come on site. As the mayor mentioned, other important factors are hand hygiene and respiratory etiquette, personal protective equipment. So this whole concept now of masking that's appropriate for the workplace. So we're hearing a lot more now about cloth masking and when and where that's recommended. And again, as I mentioned, in the print media now from the province, it's emphasizing masking in situations where physical distancing is going to be difficult. Other issues specific to your workplace, for example, ventilation that may have to be modified. Other administrative controls, training staff, training your consumers and your clientele. Potential, depending on the business, occupancy limits and other human resource policies to minimize the risk. Another principle is the physical distancing that we've mentioned. So whether it's putting up barriers in the workplace, signage, one-way entrances, one-way exits, delivery and pickup, and that curbside pickup that we've heard so much about, that seems to be going pretty well in Newmarket. So congratulations there. So that's good to hear. And those factors. And again, you have to look at your particular business to see how that's going to be managed. So I've been into a couple of different coffee shops, for example, lately. So one of them lets one person in the door at a time to pick up, and the other has a combination of drive-through and walk-in. Of course, none of them have seating. So you have to look at what's best for your business. The third important principle is the environmental cleaning and decontamination. And that's extremely important and has to be implemented on a business-by-business basis in terms of what's appropriate. And there's information on the Health Canada website about different cleaning and disinfecting products that are appropriate for COVID-19. I just want to mention one caution I wanted to mention to people. The number of poisonings in North America and Canada, United States from cleaning and disinfection products is increasing rapidly. So please be careful and read the instructions and make sure people are trained to use these agents properly. The fourth principle that comes into effect is the role of public health departments in case-based interventions. So that's either case management, which we've heard about before in the media, contact tracing we've heard a lot about, and contact management, and then the role in the public health unit of our health protection department also, and the services that they provide. I'm going to quickly go into, checking my notes here, a little bit more about control measures and the hierarchy of control measures. So really the most important control measure, as the mayor mentioned, is that physical distancing. And then we also have some engineering controls. I'm going to go through a few in a minute, but the physical distancing and engineering controls, administrative practices, and the personal protective equipment, I'm going to go into a little bit more detail on some of them that I haven't already mentioned already. So looking at that physical distancing in the workplace, you have to specify the 2-meter distance somehow with floor signage, physical barriers, or on the floor to keep people apart, or those plexiglass plastic shields in the workplace at checkout counters to protect people, rearranging furniture, those remote shopping alternatives. Those are different ways of doing it. Some of the administrative strategies that talked about screening at the entrance, making sure your HR policies around people being sick are implemented. The face coverings, limiting workplace occupancy. Those are all important issues of cleaning and disinfection. So those are a range of issues of different types of controls that could be put in place. And I think, hold on, let me see what else we have here in my notes. I did write some notes here for myself. I think that covers it for the moment, and I'll leave everything else to the questions later. Thank you.
Perfect. Thank you, Dr. Genesove. There's a lot to think about that you've given us there. And I think just before we open it up to questions, and I know there'll be a lot, I'd like to go to Kyle Burgis. And Kyle, if I know that there'll be a lot of implications for employer on the legal side, especially when we start talking about things like screening at the entrance, ensuring you have your 6 policies in place. Can you kind of give us an overview of, as employers, what we really need to be focused on?
Yeah, sure. So first of all, good afternoon, everyone. As Tracy said, my name is Kyle Burgis. For those of you who I haven't had the pleasure of meeting yet, I'm the vice chair on the chamber and also a senior employment lawyer with Buchanan Employment Lawyers. There's been a number of questions that we're fielding every day from employers that, businesses are opening back up. It's fantastic that we're moving in that direction. And as the other participants have already indicated here, doing so in a steady, appropriate way to make sure that we don't have a second wave, and all of that information is extremely important. And one of the things that is definitely on the forefront of employers I've spoken to is the question of when we can open up, or now we can open up. Is it going back to business as best normal as we can? Meaning in at least in an employment law context, all right, everybody come on back from the layoff if that's happened, or come on back from working remotely. We'll put the safety measures in place at the workplace, and we'll just start working from there. And as everyone will understand, especially when you speak with a lawyer, the context always matters. There's never a straight answer for one thing. But really something that's echoing from all of this is the question of whether or not, first of all, can an employee come back to work? There's still other things that are closed, for example, schools, that would prevent perhaps an employee from being able to relocate from, perhaps in a scenario, working remotely to going back and actually physically working in the workplace because they are the caregiver to a child who would otherwise be in school, and they don't have any other option. And perhaps in those situations, that individual would have to continue to remain from home and maybe work from home depending on the business, and continue, if not being able to work from home, continue under the infectious disease emergency leave that was introduced under the Employment Standards Act, just as a result of this COVID-19. So there is that question as to, we can open our doors, we can put into place these social distancing and provincial recommendations for the industry we're in and so forth, but how much of the workforce is going to be able to logistically come back in, not just from a physical standpoint, but just also from an accommodation standpoint, because of other things that may be still a trickle effect of this pandemic. Another question that always is on the forefront as well is under the Occupational Health and Safety Act, there is the right for an employee to refuse unsafe work. And it's a bit of uncharted territory when it comes to what in this circumstance is an unsafe workplace. If an employer perhaps is abiding by every single social distancing and provincial requirement in the circumstances and abiding by it, it may be a difficult thing to demonstrate that it's an unsafe work environment, and it may just be an employee who is has concerns about going back to the workplace with other people there, even though all of these measures are put into place. That's going to be very difficult. There is the Occupational Health and Safety Act, which allows for this right to an employee. The Ontario government has a very good sort of step-by-step process on their website as to how a right to refuse work can be addressed. And so it's a nice reference that's out there because inevitably I think that it's going to happen in certain circumstances where there's at least going to be concern from employees about going back into the workplace for those who are able to. And really an employer may want to address it just with a case-by-case scenario and see, is it something where someone continue to work remotely, or do they need them back in the workplace? These are the main sort of questions that we're getting right now. And to be quite frank, there's a lot of questions that employers have that we just don't know an answer to as of yet, because we're in uncharted territories and everyone's trying to make the best of the situation possible. So for those points that I've just addressed now that are sort of common questions that I'm having and having to address, it's sort of a general overview of what's happening now, and it's changing every day. And more businesses, I think, as others are allowed to open up before some others, those that are still not able to open up, they may have the ability to sort of sit back and watch a bit as to how things unfold for these businesses that can open up right away, and sort of learn from this and be more prepared than those who are able to open up right away. So with that, I'm sure there's tons of questions on this. Anyone who has had a presentation with a lawyer involved before, there's a standard thing that lawyers say. Reminder, everyone, all the information I'm giving is just informational purposes. It's not legal advice. There's a lot of context specific things that come into play when talking about these circumstances and that. But there are still live issues that are happening when a company doors were closed versus when they open back up. For example, like I said, about perhaps having to look after children and that. These are live issues that are going to continue until we go back to as much normal as we can. And it's going to be new sort of uncharted territory for employers where they just have to make sure that they're being wise and reasonable and smart with the decisions that they're being forced to make on things. And so with that, Tracy, I don't want to take up any more time because there's a lot of people here with a lot of questions. So I'm gonna end it there.
Thanks, Kyle. And I would just, it's question time. So I'm going to raise a question for you, actually, because you just touched on it. With a number of employees having concerns about coming back to work, what would you suggest to some of those employers in phase one that will be looking at reopening? What can we put in place sort of as a comfort to at the front end? So things like guidelines, if I think about, your safety guidelines have to be signed, your HR manuals have to be signed. Is there something that could be done here that would give us that, added piece that we have supplied our employees with the safety guidelines?
Yeah, I think that probably a wise step in that sort of scenario is to be very open with your employees as to what you are doing to abide by the social distancing requirements and the provincial recommendations and requirements in the workplace, so that your employees are aware of the steps that you're taking before just inviting them all back, and perhaps they would have otherwise no idea as to what's happening, and to perhaps answer any of the initial questions that they may have. So I think being very open and candid with your employees about what's happening and what steps the company is taking in this regard, and communicating that to your staff, I think is one of the best things that you can do in all likelihood. And I think it's also, employers probably need to be very candid with themselves as to what they can and cannot do. Just because we're in phase one and a company can open up, is it physically set up to be able to bring back employees, or what sort of steps do they need to take in place, and how long is it going to take to put those things in place to be able to open back up. So if you can think of a situation where you have individuals who are working in a really shared work environment, and there's an inability for social distancing, I think that one of those employees who works for that company, an obvious question they're going to ask is, well, I used to share a desk with 5 other people. We all would sit around it, and that's how we functioned. It worked. Clearly, that can't work now with how it's happening. What are the steps that the company is doing? So an employer perhaps being proactive in that regard is one of the best ways to sort of cut those concerns off at the pass, to let the employee know that you're actually on the forefront of it. You're thinking about it. It's top of mind for you as well.
Okay, thank you. This next question, and you also touched on it as I believe others have, but it keeps coming up. So we're getting questions, and this is probably for Mayor Taylor and for Dr. Genesove. What about childcare and summer camps? So obviously part of bringing your employees back, the challenge is the lack of childcare right now. And you know, it doesn't look like summer camps and childcare are on the horizon. Obviously, education is under provincial jurisdiction, and we're waiting for announcements on that. But from the region and the town's perspective on things like childcare and summer camps, we get your thoughts on that.
Sure. I mean, I'll start because my answer is probably fairly brief. But so we had a meeting on it today. We're looking at it. We'll probably have some announcements in the next week. But the bottom line is, if anything can occur when it comes to, and I'll speak to summer camps, which is the town's area, if anything can occur, it's going to be dramatically different than what it was, which means there'll be limited availability. Not many people will not be able to access a program because it will have to be designed in a way that is, is very secure and safe, and it will obviously only happen if the guidelines and from the medical officer of health and from the province allow for it. So if a big if, first of all, and if it does occur, it'll be very different, and it really will be there for people who have very little other choice. This isn't going to be the fun and frolicking around. I mean, we'll try to do our best, but it will be with physical distancing, and it will be with many protocols in place to protect the staff as well as the youth, et cetera. But that's all. So to put it simply, unlikely. But if it becomes or emerges as being possible as we move forward, it'll be a very different kind of experience and product than it was in the past, due to the need to place those health protocols first and foremost.
Dr. Genesove, I'll open it up to you as well, because there's private centers and other options too that will have to be thought through.
Right, absolutely. So when it's all coming on when places open, they have to be ready, and they have to have all their safety protocols in place to protect, as I said, both the workers, the childcare workers, and the consumers, the children and their parents when they come in. In this particular case, there is safety information posted by the province. This particular one, I hadn't mentioned it before, is developed by the Public Services Health and Safety Association. Again, you can find it on the Ontario.ca website, and it has specific safety recommendations related to childcare and childcare workers. And I'd encourage you to look at that for the details. There's a lot of obviously information related to hygiene. When you have childcare, physical distancing is extremely difficult, if not impossible. And a lot of the focus will be on hygiene, environmental cleaning, and personal protective equipment. So again, look on the Ontario.ca website. If you can Google, I have to keep doing this, if you can Google Ontario Ministry of Labor Safe Workplace Guidelines for COVID, that'll probably get you to the page that you need. And again, there's about 90 different guidelines there for different settings. Please read them ahead of time, get ready ahead of time, discuss them with your workers. It's really important to have clear communication with your staff, with your clientele. Make sure everybody's ready for your opening, and that they know what they're supposed to do and what to expect. And that's the best way. And get the help you need from these safe workplace associations, from public health, and and be safe.
I'll just quickly add to Tracy that, you know, when this question is going to get asked a lot in the next week, I think that the information we get next week on schools will inform a lot of the level of hope a person might have or not have. I can add that I've got a 10 and a 12-year-old that go to camps, you know, and I understand how important it is to people. But, you know, we have to put, you know, safety and the guidelines that are provided first. And if we can't provide an experience that is safe and follows the guidelines, then we can't provide an experience. We'll take it one step at a time, but I think we'll learn a bit more next week from the province in terms of where they land fully on schools. I think we all have a feeling, but when we see that, I think that'll speak volumes too, because a lot of the camps are also, by the way, for those who don't know, are run at the school sites. And so that is a big game changer as well. So just thought I'd add those comments.
That's fair. I'm going to ask for just to open up mics for a second. I think Carl, Milroy, and Kelsey, your questions were around childcare, so I think we've addressed those. Colleen, I think you had a question. Sorry, Carl, did you? No.
Nope.
Okay. Colleen, did you have a question for Dr. Genesove? Where's Colleen? Okay, we're not hearing that. So can one of my staff read out Colleen's question so I don't have to scroll? Do you have it there, Jennifer?
I do. So it's around COVID testing for vulnerable populations. So public health had sent out a memo that this was going to be happening. So the question is, when do you see this taking place?
You're on mute, Doctor.
You're just unmute, yeah.
Thank you. Thank you. The guidelines for attending and assessing at the regional assessment centers have been broadened. And so if you know, people are worried, people with mild symptoms and pre-existing health conditions, you know, please go to be tested at one of the regional assessment centers.
There was another question there, Tracy. I don't know if you saw on PPEs, and I guess there has been some issues with employers getting their hands on them. So any advice, or I know the chamber is going to be putting something else out soon, but just some difficulties they're having getting the Lysol products.
Right, so the cleaning supplies and PPE, I think are in question, and there is, the province just put out a list as well of suppliers the chambers have put out for local suppliers. But I think availability and sourcing is still the question. So I would ask Dr. Genesove to kind of weigh in on that. Are there other things other than the industrial kind of cleaning products that will be acceptable and you know, around sourcing and those types of problems?
So the question of sourcing, I'd have to leave to you and the Chamber of Commerce to help with. But I can send you a link to the Health Canada website that has a very large list of products that are acceptable for cleaning and disinfection related to COVID-19. I'll send that to you after the webinar.
Okay, so then we'll provide that list with when Tyler sends out the.
And I'll send you a link also to that list of about 90 different fact sheets on the Ontario.ca website for the different businesses. I'll send that to you also.
Okay, thank you.
Sorry, Tracy, not to interrupt. Everyone, I've provided some links, including the list that was released by the province in the chat box. It does contain companies across Ontario that are providing PPE for workplaces. And then anything after this call, I think we'll send out a full comprehensive list on the list that we have, that the doctor will provide, that what the province has sent out.
Tracy,
Okay.
Michael Sasarman has a question.
Michael, can you unmute for a second?
Hi, yeah, thank you, Tracy. A quick question around this emerging technologies, and I'm starting to see self-testing kits showing up in the media, in various online sites. Is this something that we should seriously consider, or is something that potentially could create a more effective way for people to actually self-screen and making sure that they are safe?
That's a good question. There was some immediate testing kits in the media, and then Health Canada removed them from the marketplace. I think one has to be very careful with a lot of these issues and turns to sources of appropriate advice. So again, I mentioned the York.ca COVID-19 website, the Ontario government's COVID website, and the Canadian government website, Public Health Ontario. Public Health Ontario publishes summaries of the latest research. So if you want to look at summaries of the latest research and get into some of the areas that you've mentioned, that's a good place to look also. So you see in Ontario, we're providing a lot of advice and information that's appropriate to help you. It's sometimes difficult to screen out from our day-to-day chatter some of these other information that may not be so accurate. But then if you look at the appropriate websites, you'll get the information that's been vetted and looked at.
Right. Jennifer McLaughlin raises a good question, and it's one I've heard a number of times this week on calls. Different regulations and associations that are putting out specific information for their own sector are referencing training for employees and employers. And we're just wondering, has there been talk at the region at all, obviously provincially, I'd ask the question as well, but about a training, an actual standardized training to help prepare employers as they get ready to reopen, so that there could be comfort from the employers, the employees, and the public that everybody has been trained.
I'll jump in with a little bit of an answer, at least from the standpoint of workplaces. I mentioned some of the safety associations. So they're running online virtual training programs also. So the workplace safety and prevention services for the manufacturing, service and retail sector, the Infrastructure Health and Safety Association for construction and renovation, Public Services Health and Safety Association for the healthcare sector, the municipal sector, and we mentioned earlier about the problems in the education sector. So PSHSA, Public Services Health and Safety Association, has advice for the education sector and can help people with the development of their training programs. Also, if you happen to be in one of the Southern Ontario rare mining communities, such as gravel pits, then Workplace Safety North provides health and safety for the mining sector, which would include gravel pits and quarries, which I believe we have some of in the York region also. So again, those are the resources to go through. For the public and consumer, the York.ca COVID-19 website is an excellent source of information that's being updated daily. And the Dr. Kurji, the Medical Officer's Health weekly video update, is a great source of information for the public as well as for businesses also.
I think a big point, and any of our panelists can weigh in, but we're also hearing that one of the big challenges for businesses as we try to get back to business will be that kind of public consumer comfort about going back out there. And I think that, as you mentioned, there are sites that kind of tell them about how to be safe, but I think that there's measures that we need to do it locally, regionally, provincially, and beyond, just to help build that consumer confidence throughout the different phases of reopening, but also, you know, as we're living in a COVID-19 world. And I just wonder if there's been any thought put towards, and I know you have done some ads now about protecting yourself, but just how do we help them feel comfortable going out into these workspaces again, not only as employees returning to work, but as consumers going into these places.
So Tracy, if I can just jump in, I think this is a very good idea, and I think it's maybe something the chamber and the town or the region, or maybe you know, the Northern Six or all the regional municipalities could explore doing something in partnership where we can try to get something turned around fairly quickly. That, you know, I could almost envision a training video that's, one aimed at the employer and then at their employees, and it's, I think something could be done like that. And I think it could be very, very useful. I mean, I don't think you could get to the point of having some sort of accreditation or sign off or say this group is, I think that would be a little fraught with risk on all kinds of levels and probably too hard to roll out properly. But I really, and ABDIS, maybe we could look at other jurisdictions and see if there's anything out there like it right now that we can partner on or steal. But I like the idea of something that's video based, but fairly brief to the point, and that anybody here, it's something we can offer to all employees to say, your employees here, have them each watch this 20-minute video. It'd have to be somewhat generic because as others have pointed out, the doctor and Kyle, every context is different, but that can be some of the information that's shared. Think of your context. Look at how your layout of your space is. In simple things like covering where and when to use PPE, gloves, even the issue out there's a lot of confusion about temperature taking at site, which I wouldn't mind the doctor mentioning, because I think there's some misinformation out there about that, and a lot of places we know that are now instituting taking temperatures at the gate. So there's a lot. Let's keep working on that. I think that's something that could be very useful.
So something else to jump, sorry, Tracy, to jump in on that with what Mayor Taylor was saying, that a few years ago when the Occupational Health and Safety Act was updated to include the requirement of certain workplaces, depending on the number of employees they have, having a workplace policy in place to address workplace harassment and violence in the workplace. When that came in a few years ago, I think that the legislation, in my opinion, was drafted in a way that could be interpreted and applied universally to all businesses across Ontario. And it outlined what had to be done in a very general sense, but put it on the employer's shoulders to make sure that it was applied to their specific circumstance. So as you were saying, Mayor Taylor, with every workplace being a bit different, I think that there would be a potential to be able to put in there certain requirements that need to have the employer turn and look at their own workplace and say, this is the general framework. Now, how do I apply this to my workplace to make sure that it's done? So in my experience, I've seen legislation come into play like that before. So from an employment law standpoint, I think that it is possible, but on the flip side of it, it may put some burden on the employer to be unknown as to whether or not they've actually checked off all the boxes because of how it's drafted in a very general sense. And hopefully the idea that something is better than nothing would prevail in that sort of regard. But we have seen legislation like that in the past.
Yeah, and I think that's a great point. And Leslie on our staff sat in yesterday on the Canadian Chamber. There has been a guide put together in the Maritimes because they're ahead of us on their reopening. And they've put together guidelines, and much of it we can also steal, so to speak, borrow best practices and provide that as well. But I do like the idea of a video as well.
Tracy,
yeah.
Tracy, it's Jim VanDusen here. As a business that's been open, we've got 8 different facilities dealing with the public for 7-8 weeks now, and adjusting on the fly. One of the things that I would suggest to all businesses is that you look at where your customers find you and you get some kind of video up there that indicates what you are doing to show that when they come to do business with you, that they'll be safe. So New Roads, we've created a variety of videos that talk about service and sales, and they're not detailed, they're not really hard to do, and depending on the size of your company, it can be pretty simple, but demonstrate where customers can find you, what you're doing to keep them safe. And we've received at least 100 different emails or CSI reports back from customers thanking us for how they're being treated, right? So I would, it's going along the lines we were talking about with the government, but as individual businesses, we can move faster than they can. And if you want to be successful, move fast and find a way to demonstrate to the public that you're there and you're going to keep them safe, and they will come and see you. Our business is moving again quite rapidly because of it.
Perfect. Thank you. Just to Mayor Taylor's point, and one that I had too, when you mentioned screening at entrance, Dr. Genesove, can you expand on that?
So the screening at entrance. So again, there's different types of screening, and whether it be active or passives, if you have employees, do they have a checklist before they come to work? Is there somebody at the entrance to the workplace that actively asks them questions? Same thing with with consumers. Do you actively ask them questions when they come into the workplace, or do you or just have a sign up in the workplace like many employees doing? Many workplaces are doing. So there's a range of options, and it depends on the particular workplace. I think the issue of whether one actually takes people's work temperatures at the entrance to the workplace, whether they be employees or consumers, there's some positive and negative points on it, and it might be better for some of the other panelists to discuss some of those risks of actually taking people's temperatures at the workplace.
I'll say what I've heard from Dr. Kurji, even himself, but and some other medical health experts, is that that there is certainly some concern about temperature taking at the door. That it, first of all, that a significant portion of people who have can have COVID-19 are asymptomatic. First of all, and then, but the other issue is that the percentage of people after you adjust for it that actually you might catch through temperature is not that high. But the real risk then becomes that you can create a false sense of security. Oh, I just passed that test. I'm good to go, and there's nothing to worry about. So I think I would encourage people to reach out to public health or to do some research of your own if you're thinking about instituting a measure like that, because I think there's very mixed opinions on it.
Right, and I agree 100% with the risks and the downsides of that. Those are very important points to take into consideration, and that all the other measures, the physical distancing, the personal hygiene, the cleaning and disinfection, those are really key measures that have to be put in place. I'll just also mention at this point that also take into consideration the people that might become ill during the workday, what do you do with them, and making sure you have procedures for safely getting somebody home or to their healthcare provider if they become ill during the workplace. That's also important. And again, as Mayor Taylor mentioned, some people are asymptomatic and have no symptoms at the beginning of their infection, and there may still be an issue of contagion, of communicability. So again, emphasizing the really important pillars of hand hygiene and physical distancing and cleaning and the PPE is important all the time, no matter what anybody's temperature is.
And this is where I think this training can come in very valuable, right? Even the use of gloves, where to use them, how to use them. I think people just think, we'll just put gloves on, right? And I think that you need to understand where they're valuable, when they're not. I mean, again, I think the doctor could speak to it, but I think a lot of medical health professionals, the public health professionals will say that if you're using them improperly or in a circumstance where it's not warranted, there's significant downsides. People tend not to wash their hands when they have gloves on, where you do wash your hands when you don't have gloves on. So your gloves are getting dirtier and you're touching your face, but you're not washing regularly, perhaps, like you would have. So there's a lot that can be included in some sort of training approach that I think could be very helpful to raise awareness around some of those issues.
And from a legal standpoint, when it comes to taking temperatures at the door, and that it immediately brings to mind the idea of any kind of privacy issues. What if any privacy legislation does this involve? Is there a right to be able to do this? Is there a need to be able to do it? And then also the idea of, is this information that's being taken, is it being stored anywhere, or is it not being stored? And because that creates a whole nother layer of potential legal issues. And then finally, also, when you put someone on the front lines to be taking the temperature for someone, if that is an employee of the employer, in my opinion, would really have to make sure they're going to great lengths to make sure that that person or those individuals taking temperatures of individuals who are either asymptomatic or actually have symptoms, that they are also properly equipped with the correct needs that they have to be able to protect themselves, because there is no ability to social distance in that situation. That's starting to get a little bit outside my world as to what is the proper thing to happen. But you have to realize you're putting someone in that direct path, and what sort of liability is carried with that.
Yeah. There's so much to think about, and I know provincially we will still be talking, having those conversations about, you know, is there a certification or a general training? Like AODA or WSIB, like there's trainings with certificates. I just think it'll take a lot of the anxiety off of employers, employees, and that comfort around the public. So we'll continue those conversations as well. And I do like putting something together locally. I like that idea as well. Jennifer, you, I think, indicated you had another question come in via email.
I did, and I'd heard it before, but someone's asked, and it's to Mayor Taylor. Has it been floated at all, the idea with not having Canada Day? I'm talking Main Street in Newmarket, which is obviously a huge economic event for the town and the businesses. And I know, you know, the discussion of closing Main Street at some point in the summer has come up over the years, but doing that now in the face of COVID so that restaurants with patios can expand and you've got a bit more outdoor space for patrons, businesses can have, you know, access on the street to sell their wares, just allowing a bit more foot traffic. Is that a discussion at all that's happening at the town?
Yeah, thanks. I was expecting this question to come up, but before I do, I just want to recognize and say hello to our Member of Parliament, Tony Van Bynen, who just joined the call. Tony.
Thank you.
Thank you. When you're done, there was some interesting announcements this morning, but please finish your conversation first.
Okay. The long and the short of it is so the question for those who missed it is around the potential for accommodating. I think I'll fill it out. Accommodating patios for restaurants that don't have patios. First of all, I would say town-wide, and then the idea of accommodating restaurants with patios in the downtown or on Main Street where it's very constrained and difficult. And then finally, the idea of can you further accommodate that potential downtown and Main Street by closing the street and allowing patios to come out onto the street. So we're in significant conversations looking at all of those options. I'm confident that we'll be able to move something forward. Exactly what it is yet isn't clear. There are all kinds of issues to weigh. Some of them are legal and related to liability. Certainly one of them is, and probably the key one for the closure of the street. First of all, is that desired by most, if not all, of the businesses on Main Street? And we would have to do some consultation. But number two is we've got to be very careful that we're not creating a public gathering space and destination at where we're at with COVID-19 right now. We're still at a stage where we're trying to be very cautious. You know, the direction still is 5 people or less. And so while we want to support businesses with a patio opportunity when that arrives, and it hasn't arrived yet, let's be clear, from the provincial direction, we also don't want to get to the point where all of Main Street becomes a toned down Canada Day on the weekends. And there's, you know, people just going up and down by the hundreds, having a look and seeing and going in and out of So that question is the one that's weighing on us: is can we do a closure? First of all, if we could, and it was desired by the business community, could we do it in a safe way? That question is still hard. We're struggling with it. But then number two, if we don't, is there ways to accommodate those businesses with patios that doesn't involve a full closure? I think there are some ways. And then of course, I want to make sure that all of the restaurants or businesses that think they could take advantage of that town-wide know that we're also looking at that, because, and of course this would be temporary measure, but it's something that I think other jurisdictions are looking at, and certainly we are. So stay tuned, there'll be more news on all 3 of those: town-wide, the downtown, and potential full street closure, but you know, big question marks around them yet.
Thank you, John.
MP Van Bynen, thank you for joining us as always, for your time. Did you say there were some announcements this morning that you'd like to share?
Yeah, so firstly, let me apologize for signing on late, but the Prime Minister had another one of his many conference calls. What he was able to highlight is that the emergency wage benefit, the CEWS, is now supporting over 2 million people across the country, covering 75% of the wages for employees in the hard-hit businesses. He announced this morning that we'll be expanding the emergency wage subsidy for an additional 12 weeks to August the 29th to ensure that workers continue to have the support that they need during these difficult times. And they will be expanding the eligibility for the government to ensure that these workers in more sectors have the support that they need. The real key is that they will be consulting with key businesses and labor representatives over the next month for potential adjustments to the program to incent jobs and growth, including the 30% revenue decline threshold. What that does is we're changing our focus to maximize the support that business needs to support the post-economic crisis and the get back to work strategy. So the good news is that we're looking at modifying the programs, but more importantly, extending the programs in a very critical time. So that was the good news this morning. It was worth the wait from my perspective.
Perfect. And Abdus just sent me a note saying that that is being updated as we speak on our website. So continue to visit that for those links. Was there any questions? And I'm looking at the team as well because that I might have missed.
There was one that just came in, Tracy, again for the mayor, and I've heard a bit of rumblings, but maybe you could clarify the plan for the farmers market in town. A few people have asked about that.
Yeah, sure. So I think, as most people know, the farmers market is going to be operating on a scaled down basis for food only at the Magna Center, very spread apart, and with precautions put in place related to 6 feet distance, et cetera. So, and our staff will be very engaged in making sure that that functions the way it should. In terms of then the next steps, it's very hard to say. Certainly in the next month or two, I don't see it returning to the Riverwalk. I think it's a fairly tight environment there, and you know, because the location it's at is the only place I think it can operate right now in a safe manner. Love to, like everybody would love to wander around the farmers market and run into people I know and chat and relax, but it's just not realistic at this point. Hopefully this summer we can see that happening, but it's just too hard to say. I think, like so many of the questions that are being asked, and is that we have to take it one step at a time. We have to take the guidance of the province of Ontario and the medical officer of health, and we have to put safety and the necessary precautions first and foremost. But it's going to be an iterative process, right? We're going to have to, but we have to be guided by science and by data, right? So if the numbers can continue to improve, then I think you'll see opportunities emerge. And one of them may be later in the summer, the farmers market. With, of course, we'll like everything that occurs, we'll be operating in a different way. But maybe there will be an opportunity there. But we have to follow the advice of the experts and make sure we're always erring on the side of caution and safety.
Great. Now, I know that there might be additional questions. This is meant to be the first of many of these conversations, so I'm sorry if we didn't get to your questions, but I know that we're over time now. I did just see that Deborah, our past president and CEO, hi Deborah, mentioned that you can also order veggie boxes online from the farmer market business.
Good point.
That's something to keep in mind as well. And I'd just like to thank again Mayor Taylor and Dr. Genesove and Kyle Burgis for being with us today and helping to answer some of those questions. And again, if there's some that we haven't answered, we'll look at those and try to get back to you. And we'll have another conversation like this coming up as well. And watch our website. There's lots of updates on there as well. So thank you. And I wish everyone a safe and happy long weekend.
Can I add one last thought, because I think it's important?
Absolutely.
It's the long weekend, everybody. First of all, have a great weekend. But please keep in mind, for those who are thinking about it, fireworks are complicated and hard to do while social distancing. It is allowed, but it is not allowed in parks. It is not allowed on a street in front of a house, and it's not allowed to be done with neighbors and friends. You're supposed to be your own family unit alone. But have a great, awesome, long weekend with your family alone. Look, we'll get through this one step at a time. But I just wanted to focus on that long weekend and be careful on the trails, be patient with people on the trails, and be safe in your celebrations.
Thank you, Mayor Taylor. And thank you again, MP Van Bynen, for joining us as well. And Nicole Gibson, from a counterpart of mine from the Ajax Pickering Board of Trade, who joined us today too. Thanks, everyone. Safe weekend.
Bye. Thanks.
Thanks, everyone.
Thank you.
Thank you.